On behalf of the entire team, both our volunteer members and our staff, I'm honored to provide a quick run-through of our sampling of our 2021 activities. But please visit the Academy website for a more comprehensive set of information on what we've been up to over the last year. And also make sure that your membership profile has you signed up to receive all our communications, including our weekly connections emails. They'll provide you up-to-date information as we go through the next year. So let's start in the advocacy arena. First of all, I'll go through this quickly. I encourage folks to take a look at the session that was held on Thursday afternoon. That gives a deeper dive on all the advocacy activities of the Academy over the last year and our priorities coming forward in 2022. But just as a highlight, although we are operating virtually, the Academy has remained very active in our federal and agency outreach meetings, with several meetings with the White House Domestic Policy Council, FDA, CMS, CDC, and all sorts of other critical beltway agencies and organizations. On top of that, we have submitted over 60 comment letters so far this year on various legislative and regulatory and reimbursement topics, including the annual critical letters on the physician fee schedule and the IRF prospective payment system. Building on our innovations from 2020 when we pivoted to the virtual world, we also expanded our Day on the Hill activities virtually, and we're able this year to reach many more congressional offices and also include many more members in our efforts. And this will be part of our ongoing activities even after we return to face-to-face meetings. Highlighting a few of the top priorities that we had in terms of conveying in these meetings, we continue to be focused and prioritize on streamlining the prior authorization process, and we successfully supported the reintroduction and the advancement of the Seniors Timely Access to Care Act, which advanced those concerns. The Academy has been very strongly opposed to the proposed CMS IRF Review Choice Demonstration Project that we feel is an assault on the independent practice and physician judgment. And we, through our AMA team, volunteers and staff, successfully drafted, introduced, and advocated for the passage of two important resolutions at the AMA, one on the increased funding in research and education for post-viral syndromes, and the other one on preventing Medicare Advantage plans from limiting care. In our continual prioritization of scope of practice, we published a new scope of practice resource, a comparison of U.S. education and training for physiatrists and other healthcare providers, that we hope is a resource that our members can use at the local level. But we also were engaged in several state-level legislative activities that were seeking to expand the scope of practice for nurse practitioners and physician assistants, where we were directly engaged as well as helping to create grassroots efforts to engage our members. On the emphasis of helping our members look at the future and the cutting edge of where medicine's going, the Academy also convened a telehealth innovations work group this year to look at opportunities to utilize telehealth to truly be transformative in the future opportunities and value of physiatry that we can have in the healthcare system. This also ties very directly to many of our PM&R bold priorities. Switching over and looking at our reimbursement front, we were very focused working with collaboratively with our peer societies and peer specialty societies across the House of Medicine, and meetings with the AMA, meetings with the Centers of Medicare and Medicaid Innovation, to help really promote payment model opportunities for and improvements. Lots of activity about alternative payment models and different activities, and we are working both independently to represent physiatry, but also collaboratively across medicine to have a single voice of medicine in these discussions. The Academy also had several critical representations on technical expert panels. We disseminated the Academy produced principles for Medicare Unified Post-Acute Care Payment Systems to relevant stakeholders, including some distributing and discussing in our meetings with MedPAC. And we continued our efforts to be strong advocates and aggressive in our efforts for appropriate coding and reimbursement at the AMA, CPT, and RUC level. And on that front, one of our greatest successes this year, which although was really a multi-year commitment, was the the gain this year of PM&R having a permanent seat on the AMA Relative Value Scale Update Committee, the RUC Committee. This is the first time PM&R as a specialty secured a permanent seat on this committee. And again, this is an effort led by your volunteer peers, Dr. Grierson and many other leaders from our reimbursement committee, working with staff who made this a top priority and a commitment over several years. And this is a huge success for the specialty and the academy. As a reminder to our membership, through your support, the Academy also is very active in representing the specialty well outside the normal advocacy parameters of the Beltway and federal regulatory and legislative arenas. Through a number of coalitions across the House of Medicine, the Academy represents physiatry, the interests of physiatrists and your patients in these coalitions and collaborations, and this is an important piece of our advocacy work. As we look to 2022 priorities, we will be, as mentioned, continuing to expand our influence on our Hill visits, harnessing the virtual as well as the face-to-face experiences. We are setting a priority on focusing on reducing physiatrist burden, and we'll be advocating for reforms to prior authorization and to the appropriate use criteria programs. We'll continue our commitment and efforts on scope of practice, and we'll have new position statements coming out. And as an important project coming out of our future of inpatient rehabilitation efforts, we are convening a group of stakeholders to establish a consensus definition of rehabilitation physicians and medical directors in IRFs. So these are very important priorities for 2022. As we continue, we'll also look at continue to expand on the efforts of telehealth, both on the developing the models of those delivery systems, as well as advocating for appropriate and necessary reimbursement to bring those to fruition. We will advocate for PM&R inclusion and appropriate reimbursement, and then all the dynamic discussions and dialogues going on about alternative payment models. In our quality and registry arm of the Academy, we continue to advance physiatry's ability to reduce variation in care, achieve predictable results, and improve outcomes for patients, healthcare systems, and organizations. Exciting this year, the Board of Governors expanded the scope beyond just our registry, which I'll get to in a moment, to allowing the Academy to begin to build the infrastructure and processes to develop PM&R specific guidance to translate quality evidence into applicable recommendations that enrich PM&R's ability to provide patient care and improve health outcomes. Ultimately, the Academy's aim is to be the hub for defining best practices for the specialty, determining what gaps in quality exist, assessing how we can close those gaps, and seeing if data collection through the registry is feasible, and will advance those efforts, all while educating and advocating for physiatry, using this information to advocate and build education for our members. So one of those key, as mentioned, one of those key aspects of all these goals is our registry, and the Academy registry continues to make gains in 2021. We added 7 sites that started to collect data and onboarding them to collect data on the ischemic stroke and low back pain registries. As a reminder, the Academy Registry marries both a collection of data from the electronic health records, as well as collecting data directly from patients for the longitudinal component via a developed patient report outcome module. So it's this data that the registry collects and aggregates that will be used by the participating sites to examine how their low back pain, their ischemic stroke patients are doing both during treatment and post-treatment. So I do want to pause and really call out the champions who are helping lead the registry efforts, as you can see here on this list. Turning to our membership and membership services activities, we continue to expand our commitment and efforts to include and engage all members. So a few items to highlight: we've continued our critical conversation series, which is a series of thoughtful virtual discussions on racial equities and access and inclusion in today's world. We're very proud to have received, the Academy received the Association Forum's Welcoming Environment Organizational Award, which is an award given to the association that demonstrates exemplary outcomes in providing an inclusive and welcoming environment and culture for our members. In addition, the Academy was selected to participate in the Equity Matters joint initiative between the ACGME and the Council of Medical Specialty Societies to drive measurable improvements in equity by increasing physician workforce diversity and creating clinical and learning environments that are safe, inclusive, and equitable. On top of all this, our member communities continues to grow both in numbers and activity and influence. So in 2022, we plan to continue these efforts and expand, as well as start utilizing the information that we've been collecting on our members to better serve and identify different communities for targeting necessary resources and opportunities. And we also are going to be advancing, as you'll hear in a little bit, many more efforts to directly engage the stakeholders to understand our PM&R bold visions of the specialty now that we have much of the foundation of that program in place. As a reminder, the Academy is also committed to our career services and have a number of services that we continue to manage and grow that support our members through their professional journey. Quickly turning to our education arm and starting with the annual assembly. As of Thursday morning, when we kicked off what we'll call our main event, we had nearly 2,600 physiatrists registered, including nearly 500 residents. Isn't quite as high as last year, but that's before all the virtual walk-ins on Thursday, Friday, Saturday, and Sunday. But it is also higher than any face-to-face meeting we've had in history. So the virtual component, the virtual opportunity is a piece of the puzzle that is here to stay. This annual assembly had 147 sessions, and you can see nearly 144 CME credits available. Our programming started early as we started building and offering opportunities around this assembly in August with medical student programs and virtual residency fairs. They were very well received. Continued through September and October with the quiz bowl and community sessions. We had our pre-courses kick off prior to the meeting, and then the virtual job fair on Wednesday evening. As a reminder, most of these sessions are all available on demand. The main event started Thursday morning. As you can see here, I won't read the entire slide, but this year we had many more live broadcasts than recorded sessions. Live broadcasts, hoping to engage much more direct engagement with the audience in Q&A. We did have some great advancements in our virtual poster opportunities and technology around there, as well as the other offerings that we offer with the corporate exhibit floor, career services, and other activities. We also try to sprinkle in some special events, and we hope you join us tomorrow morning at for the closing session of this assembly, our FIS Talks, which has over the last year has really proven to be one of the highlights of our assembly. Don't miss it. So what beyond the annual assembly, what's next? Well, the pandemic has really helped us transform our education portfolio, to really embrace the virtual and digital opportunities. Last year, we launched our learning portal and subscription model, and this year we were up to 2,000 subscribers, a large portfolio of products that get updated each quarter. If you're not subscribing to this, I encourage you to look at this opportunity. It's a great value to our members. We also started developing many more, what we'll call them live virtual events. So we have monthly national grand rounds, which are topics that are broad for diverse topics that are relevant to physiatrists. We've also started developing and rolling out spotlight conferences, which are more in-depth, interactive virtual courses. Continuing on our live virtual events, we have transformed our prior early career courses to really engage the virtual environment. And through this process, we are really able to engage many more early career members than we have in the past. So we'll be staying with this virtual environment at least through 2022 and probably always have a component of it. Also using the virtual environment, we engaged a telehealth practice collaborative where members came together to network and share and work together to help advance and develop their telehealth practices and even build quality improvement projects around those efforts. So the opportunities for us to continue to expand our education via the virtual live events are endless. But we also are going to be bringing and are excited to bring back our live events, and especially our STEP programs in 2022. So we will be continuing with our ultrasound STEP course and teeing up our spasticity and concussion step courses. Excitingly, that we are piloting a virtual assessment for our ultrasound course that will be an opportunity that we think is going to be well received by our members to reduce their barriers to complete that course, reduce their expenses. And we're excited to see how that works for ultrasound and how it's applicable to our spasticity, concussion, and future STEP programs. After some pandemic delays, we are bringing back our leadership and institute programming, both our collaboration with the Kellogg School of Business for the Business Administrative Leadership Program. We've transformed this to be a combination, both live in person as well as virtual structure. And separately, we've also will be launching our medical directorship program, which is a fully virtual program. Looking at our priorities for 2022, we are excited. We will be live next year in Baltimore, but there also will be an ongoing virtual opportunity for attendance. So we're excited about those opportunities, and mark your calendars for October 2022 from October 20th to the 22nd. Our live virtual events will be launched and coming soon. Will be a PM&R review course and more practice collaboratives and more education on telehealth. We are prioritizing building and defining a curriculum scope for APPs, as well as building a curriculum for biologics. Much of what we've talked about already in terms of the priorities have tied to the PM&R Bold vision and strategic plans, but just to highlight a few items there that we did write and publish a musculoskeletal manuscript that was published in the PM&R Journal. That's a deeper dive in understanding our vision for our bold vision for musculoskeletal care and physiatry. Please look for that publication. We also work with the cancer community to help define and document and build consensus on what defines core services for cancer rehab. Working both with the musculoskeletal community and the cancer rehab community, we developed a training curriculum to help prepare physiatrists to meet future practice needs and align with the PM&R Bold visions. This is a practice curriculum that will have several uses, both in the academy and as a resource to our members. And we've launched a series of PM&R Bold dialogues, not only across all the that will be expanded across all of the bold pathways, including the spine and pain rehabilitation areas, the pediatric rehabilitation areas, and others. So our priorities in 2022 around bold, as many of those have been covered in previous areas, but one of the things I want to highlight here is really, again, as we now have the foundational components and plans and starting to build the data around these areas and consensus around these visions, the launch and the work of our specialty brand expansion committee is really going to start building from there and building off of some of our long COVID activities to start reaching out to key stakeholders to build awareness of the specialty within the visions that we have developed under PM&R Bold. So talking about the long COVID initiative, and to start wrapping up, in February of this year, 2021, the Academy has been focused on a series of initiatives around long COVID and really focused on the needs of individuals who are and will be suffering from long COVID. We put together a comprehensive effort that led this in several ways that I'll highlight here. One included an outreach, a media relations outreach, as well as an advocacy outreach to the Biden administration and to Congress, which included a sign-on letter from many of our peer organizations to call on the administration to really prepare for this next phase of the coronavirus crisis. In this effort, we had direct communication with the administration. We had letters to President Biden and Congress. We also took out full-page advertisements in the Washington Post that called for a comprehensive national plan. So this comprehensive national plan included three major components: resources to build necessary infrastructure to meet the needs of this crisis, equitable access to care for patients, and research to advance the medical understanding of long COVID. Hopefully you've seen that we also launched the first dashboard for long COVID. This is building off Johns Hopkins data as well as US Census data. This is a real ability to drill down by zip code into different communities to see the impact of long COVID and what's predicted. And this has picked up some media interest and is being utilized, both giving PM&R physiatry a great and appropriate focus, as well as the Academy. But one of our major efforts has been the launch of the Multidisciplinary PASS Collaborative. Dr. Weinstein alluded to this previously, but this has really been an effort to foster focus and meaningful and ongoing clinical exchange between the medical community to assess and implement appropriate clinical practice for treating and following all the long COVID issues. These are not just PM&R issues. We're really talking about interventions beyond just PM&R. So this has been the goal of the Multidisciplinary Collaborative, to foster this engagement. And it's been exciting to see that we have well over 30 post-COVID clinics participating in this. They have varied multidisciplinary expertise beyond physiatry, neurology, therapists, et cetera, pulmonary emergency care. And they also represent both patient and federal representatives in these collaboratives. So the collaboratives also are led by a multidisciplinary group. As co-chairs, Benjamin Abrahoff as a physiatrist from Penn Medical, Eric Herman, a primary care physician from Oregon Health and Sciences University, and Jason Malley, a pulmonary and critical care medicine physician at Beth Israel Deaconess. So this has been a great opportunity where physiatry has stepped to the forefront to pull together a multidisciplinary effort around this public health crisis. What we've been working on in the collaborative is following an iterative development process approach to achieve consensus on assessment and treatment recommendations for a series of consensus guidance statements focused on the most prominent past symptoms. The first publication has already come out on fatigue that was published in the PM&R Journal. There's a series of other statement and topics on cognitive impairment, breathing issues, cardiac, pediatric documents that will be following in publication. Each of these also importantly includes an emphasis on health equity. And this was really our first forte and our opportunity to learn how to incorporate the critical issue of health equity in all the previous work, the future work of the Academy. And through great volunteer leadership, through several of our members, we've put together a plan that we've been implementing through this collaborative that will continue on into all efforts of the Academy. So again, I thank you for your support of the Academy, and look forward to continued success in 2022.